Welcome to the Dr. Diane Show, where we explore revolutionary expansion of mind, body, and soul with me, Dr. Diane Hayden. With over 20 years of expertise as a mindset warrior, perspective shifter, and unshakable optimist, I am dedicated to helping you reach your wildest dreams in business, health, performance, and relationships. Learn about the power of thought and how it shapes your life to take risks, change careers, find love, go on adventures, and live passionately with me, Dr. Diane. Get ready for revolutionary ways of thinking, being, and creating an amazing life. The Dr. Diane Show starts now. Hello, everyone. I'm Dr. Diane Hayden, and you are listening to the Dr. Diane Show on Transformation Talk Radio. Stay with us for the next hour, where we will explore revolutionary expansion of mind, body, and soul. Join me on the first and third Thursdays on the Dr. Diane Show, where I have experts from around the country teaching you cutting-edge therapies on longevity medicine, natural health, mindset, and soul purpose to help you shift your perspective and become a mindset warrior like me. And please like and subscribe to my channel, Dr. Diane Hayden. I'm excited today to have Dr. Tracy Cormier on our show. She is an adult nurse practitioner, cardiac specialist, and founder of TLC Healthcare Solutions, which is a nurse-led, relationship-based practice dedicated to bringing humanity back to healthcare. With more than 25 years of experience in inpatient and outpatient cardiology, complex chronic disease management, and primary care, Dr. Cormier is passionate about providing patients with accessible, unhurried, personalized care. At TLC Healthcare Solutions, she combines direct primary care, specialty level cardiology services, and an innovative in-home sleep evaluation clinic, helping patients improve long-term health through prevention, education, and meaningful connection. Her mission is simple: restore the heart of healthcare and empower people to heal. So welcome, Tracy. How are you today?
Oh, I'm wonderful. Thank you. That was a great introduction. I really am grateful to be here and speak with you and sort of review what direct primary care is and kind of just get more information out there.
Yeah, for sure. And I bet that that is a term that a lot of listeners have never even heard before. So I want you to definitely get into what exactly that is. But how did you even get involved in healthcare in terms of what you do? And how did that kind of like lead you down the path to now starting your own practice and doing what you do now?
Right. So I've had a very long path. I actually have been in healthcare for 25, 30 years. I was very fortunate. I was a paramedic back in the day out of high school and sort of moved forward each step of like the medical field. I became an LPN, I became an RN. I back in the day when I was in high school, I worked for my father's primary care cardiologist, who really sort of lit that fuse for me for cardiology. So yeah, I was very fortunate. So I kept going to school through for like 15 years, and recently, within the past 5, 6 years, completed my doctorate degree. And I have worked inpatient, outpatient. I've been a director of cardiac services. I've started new practices and I'm seeing recently like how broken healthcare is and where the connection has been lost because it's turned into a business. So
Right.
that really sort of motivated me to do what I'm doing. That I've been building my practice for the last 2 years. It's been a slow go, but it's going. And just getting the word out there and educating people like what is direct primary care.
Which leads me to that question. Yeah, I mean, I think people are kind of like, I know what a primary care physician is, and, but what's direct primary care?
So direct primary care is different than traditional. So it's basically a member-based um, sort of fee,
Model.
I guess you can call it, right? So on a monthly basis, and it's just that straight fee to have access to the provider. First of all, just to sort of back up a little bit, I'm sorry. I when I was a director, I saw how broken primary care is. I was in a primary care office. These doctors are seeing 30 to 40 patients a day. And people are waiting 2 to 5 hours in the waiting room to see the doctor. I'm like, this is not right. And then they would only get 5, 10 minutes and have to come back for another problem. So what are we doing? Insurance
Hmm.
is making us check boxes on people. This is what is happening. Check your preventative care, check you did your blood work, but no one's talking about the root causes of what's going on with these clients. And I felt that we needed to step back, and direct primary care gives me the ability where I can see a limited panel of patients compared to the average primary care seeing 2 to 4,000. That's on their panel. That's a lot of patients where I'm probably going to have about 2 to 300 patients, and they're going to become my family. I'm going to get to know them. We're going to have relationships. We're going to address all their root causes. We're going to figure out, like, how can they be healthier? How can they be happier? Not just from all the check boxes and all the preventative care that we need to do, but there's all these other faucets, which I love about natural nutmegs, because you also address that with all the holistic and other opportunities that are out there to keep people healthy, not only body, but soul, mind, and spirit.
Yeah, for sure. I mean, I don't know if there's anybody who actually has not had this experience where they've gone to the doctor and literally, like you said, either had to wait. This just happened to me with my mother last week, honestly. I mean, we literally sat in this waiting room for the whole visit, probably took like 2 hours for her to literally have like 10 minutes with the doctor, which was crazy. And we're like, this is nuts. I mean, and not only that, like you're saying, what can you accomplish in a 10-minute visit? I mean, if the person is perfectly healthy, great, in and out, that's probably all they need. But if someone has any kind of a complaint, there's no way that you're going to have time. So this is a brilliant model in terms of what you're doing, and I think it's really the future of healthcare, the way healthcare needs to move to.
Yeah, I mean, I agree. And, some people hear it and they're like, oh, it's a fee for service or this membership. And to be honest with you, when you compare it with your healthcare insurance, it's like a 1-2% cost. Most membership fees for this service, there's different tiers and all that, but they range from anywhere to 75 to 150 a month. And that includes like so many visits and consults and, you know, having, your visit be more than 10 minutes, having the accessible to do it over the phone so you don't have to leave work, having a video, so you don't have to miss a work day just to see a provider. And you have that connection. I can't tell you how many patients I see. And I just had this wonderful old couple I took care of in the hospital. And he's like, yeah, we've had, like, every time we go to primary care, there's a new primary care doctor there. Nobody
Hmm.
stays.
Yeah.
Yeah.
And I think, if anyone who's known me for a long time and known me through the magazine, Natural Nutmeg, knows that, I'm a big, big proponent in teaching people to take responsibility for their health. And that means paying for your health care if you need to do that. And what I
Mhm.
say to people is, okay, fine. So, sure, maybe your insurance, you just want to go see the providers that your insurance covers. But when they're not taking care of you the way that you need to be taken care of, or all they're doing is just slapping a prescription down, and then now you get another problem from the prescription medication, in the long run, what is it going to end up costing you? When you could have just done something like this for, to me, $75 to $100 a month is minimal. I mean, that's that's just, everybody should be able to figure out how to do that. There's ways that you can cut costs with going out to dinner or a lot of other things.
Right.
What is the long-term potential cost of not having someone like you, not having a direct primary care person? I mean, I think that ultimately it people don't think that far ahead, but it may be in the thousands.
Right. I think people are just, some of the older folks I see remember when healthcare was good and the doctor spent time with you and he reviewed everything. But now there's no time. And some clients have anywhere between 4 to 6 doctors. And your primary care used to be the person who would put all that information together. And now they don't even have time. It gets put into a chart somewhere and they look at it for 2 seconds and maybe they address it with you or not. That was another reason why I also decided to go this course, because I was seeing cardiac patients and saying, hey, what is your endocrinologist saying? What is your nephrologist saying? And they'd be like, you're the only person that ever asked us
Yeah,
about our other
nobody's
doctor.
talking.
I'm like, when do you know what else is talking about your other doctors? Like, I'm calling and texting your other doctors.
Yeah, I mean it is pretty crazy, honestly, that no one talks to each other, and that's there's a huge issue with that with pharmaceuticals, right? Like, who's catching pharmaceutical interactions and things like that. One doctor's prescribing this, somebody else is prescribing something else. Sometimes the pharmacist catches it, sometimes they don't.
Yeah, it's very true. I still will call a pharmacist probably 2 or 3 times a week, just for guidance because they are experts in the medications and everything. New medications are evolving so fast. I've been in healthcare for a while now, and things used to take like 5 to 10 years to change. Now everything's changing rapidly. So it's really hard to keep up with all that new information, new studies coming out on how to provide, all this new care that's available to patients and clients.
Yeah, exactly. For sure, for sure. And so when did you open your practice?
So I opened my practice as a consulting agency about 2 years ago
Okay.
because here in the Northeast, there was all the laws that went in place where you could see your medical record. So people would call me to interpret their records because they didn't understand anything. And I then decided that, primary care, no one's really doing it anymore. And after I was the director and I was out, creating a cardiology practice, I said, you know what? There's another way, and I'm going to do this. And I'm going to bring back what healthcare means, which is creating relationships with people, right? So I then just morphed myself at the beginning of 2025, redid my whole website. I was going to, my pitch is to really come to people's houses and also be accessible via phone or video. One of my friends was worried about my safety. So she gave me an office space in South Windsor that I go to usually once or twice a week to see clients, which is nice having that there. And right now I'm very fortunate. Most of my clients are within a 30-mile radius. And, like I told them, we have to see each other once a year. I do a lot.
Exactly.
I do a lot of talking and texting and videoing with all my clients.
I
So
love it. I love it. Well, you're listening to the Dr. Diane Show. We're going to take a quick break. When we come back, we'll explore more with Dr. Tracy Cormier of TLC Healthcare Solutions. Stay tuned. We'll be right back. We're back on the Dr. Diane Show with me, Dr. Diane Hayden. But before we continue, I want to make sure everyone knows how to contact me. You can find me at www.drdianehayden.com or at either of my two publications, www.naturalnutmeg.com and www.essentialnaples.com. And you can learn more about my guest today, Dr. Tracy Cormier, at www.tlchealthcaresolution.com. That's spelled TLCHealthcaresolution.com. So before we just went to break, Tracy, we were just talking about, when you started your practice and how, and well, I want to reiterate so that you can also see people virtually, although you do like to see people in person. Um, or is it mandatory that you actually have to see somebody in person at least like once a year?
normally it's once a year I need to see them in person.
Okay.
And then from that point, unless there's a problem and I need to see them again, that's where I give them the option to come to the office or I can come to their home.
Right, right. I love the fact that people have, so much access to you. And, you said at one point, it's a difference of being one of 300 patients instead of one of 3,000. I mean, you mentioned that when we started that most direct primary care, more primary care traditional practitioners have 2 to 3,000 patients. And I think we're all kind of starting to understand that now. I don't know if people had a concept of actually how many patients physicians were seeing, but I know that, you go see somebody once a year, they sometimes don't even remember who you are, let alone like, the things that are going on with you and all of that. So what does it mean for a patient to know they're one of 300 versus one of 3,000?
So it means we develop a relationship. I know who you are. I know your family. I know what your stressors are. I know what your goals are. You're not just a chart. You're not just a number. You're not a checkbox. The level of attention that you get from me, it really helps improve healthcare outcomes because I understand and I care, and you feel that immediately, and I want to work with you to make things better. And a lot of it, as you said when we first started, is educating the client, and just trying to get them to understand their healthcare process and what we can do to make it better. This is it's a human experience that I think we've moved away from.
Mhm.
So that's kind of what I'm trying to bring back to being a primary care provider. Kind of like when back in the 1700s, 1800s, a doctor came to your house, and knew your whole family.
Exactly. And why wouldn't anyone want that? I mean,
Right.
when you think, I think really it's that people don't think it exists anymore, and
Yeah.
that people have gotten so um, just accustomed, or even like, I'm going to use the word brainwashed actually, into just believing that all they can do is just see the doctor that their insurance covers, right? See the specialist their insurance covers. If it doesn't cover it, then I can't go. Like, is it really a matter of even the money, or is it just the fact that people don't even know that there's opportunities like this, like
Yeah.
that you exist, someone like you exists, that they can establish a relationship and really get to know, and you do know their whole family. And there's something to be said for knowing other family members, genetics, all kinds of things that you're going to learn about that the typical traditional primary care person is never even going to come close to understanding.
Yeah, that's exactly. I call it people are stuck in the cogwheel of the cogwheel of
Right.
the current care system. um, you know, for me, it's also, the time, right? The time that I'm going to spend with these patients and their family, and they're going to feel like they've been heard. They're going to be more engaged with me because they're not going to feel like they're being shut off or shut down or, hey, you need to make another appointment. They're going to develop, like, I think they're going to be more honest with me because I'm going to take the time to spend with them instead of, okay, yeah, they're going to ask me about my drinking and my smoking. Yeah, oh no, I quit that a long time ago. But maybe we'll be able to have more elaboration on that and what's really going on. And the education that supply to them, they may have more follow through. So, I haven't seen any studies yet, but I would think that healthcare outcomes would improve with going back to one-on-one sort of provider care instead of the business model that we're stuck in.
Oh, absolutely. Because not only I think is it better physically, but it's also better from a stress perspective and emotionally for that patient too, right? Like, how many times do you think patients have come into an office and never even gotten to talk to the doctor about what other things might be bothering them other than maybe like one chronic presenting symptom, right?
Mhm.
Yeah, it's just, how long can that go on before people are finally, like, done with it, fed up with it, and realizing that this is causing a huge stress on you in emotionally, as well as not good for you physically.
Yeah. So, I mean, I have, since I've started doing this, I have a lot of my friends and family asking questions about it. And at first they're like, we don't understand what you're doing. And then they're like, after I talk to them, I'm like, and they're like, wow, you're really onto something. I'm like, I know I am. And I have
Yeah.
the patients who are my clients now, I have like a couple different levels that I have for services and stuff. But it's just the connection that I make with them, and I tell them, prevention is not a separate visit. It's woven into every conversation that we have, going over your whole history and what's going on right now. It's a continual process. It's not just this, here's this problem. Okay, this is what you got to do. See you later. Go see another doctor.
Well, I'm
So,
glad you used the word prevention, because I was going to say, as I was talking, like, we've mostly been talking about people who have, maybe it's a chronic issue or illness or something like that's presenting itself. But what about people who are relatively healthy, like someone like myself? Why wouldn't I come see you? Why wouldn't I establish a relationship with you to stay, in that preventative mode?
exactly. So I have a lot of young clients also now that are coming to me just for preventative wellness. It's nice to see the 20-something-year-olds actually caring about their health. Unfortunately, that age group tends to have a lot more risk because of their sedentary lifestyles that they
Mhm.
have. So, again, it's for them, they're on like a lower tier, but we do a
Yeah.
physical every year. We do blood work. And for them, they love it because I'm like, oh, we only have to really see you once a year. This is so convenient. They're of the age of texting and chatting. So, for them, it's an education. And we talk about things that are pertinent for them in their age group. And they like that. They're like, boy, they a couple of them, you sound like my mother. And I'm like, I'm sorry.
Yeah.
But not only the mother aspect, but really the health solutions and concerns are that we can work through to help them be healthy as they get older into their 40s and 50s and help sort of prevent some of these disease processes that we're seeing.
So walk me through what it's like to work with you. Okay, let's say whether it's like, and I know it's going to be individualized and different for everybody, but let's say it's someone who is just looking for preventative type things or and whatnot. Like, what's the process of how does it work when I come to see you?
So normally like I said, come to see you and your house, or you come to the office. Normally you're with me. Most of my first visits are about 2 hours long. It's a
Wow.
long visit. We
Yeah.
go through everything. Sometimes I do try to get some information before I meet with you. Sometimes the clients have a lot of information that they'll upload or will review at the same time. And then I try to look over like what are the pertinent issues that are going on or what has been the long-standing issues. What have you done with that so far? Who's evaluated. So it's a really comprehensive, to be honest with you. Everyone is very individualized for whatever healthcare concerns that they have. But most of my first visits are an hour and a half to 2 hours.
Wow, that's amazing.
Yeah.
And then moving forward from there, is it basically like, let's say, pretty healthy. I check in with you when I need to, or do you check in periodically, or how does it go like throughout? I'm assuming like this is a year program, let's say.
Correct.
And how does like the check-in or follow-up go?
So depending on if you're a younger person, usually I just kind of check in. I'll send a text quarterly just to see anything going on, everything okay. A lot of times I'll send like I just sent out holiday messages to all my clients. If you're on more of a complex care sort of model, normally with that model, that's like my top tier. It's a monthly check-in. We check in every month. We have quarterly visits that I do like to meet in person for those, especially if you're somebody who has multiple problems. So it's a little different for everybody and kind of where you're at in your health. But yeah.
Yeah, I mean, I love the fact that when you think about the times where you need, somebody might need something from their doctor, and like let's even say it's just like a refill on a prescription or something, just something that is not that intensive or whatever. How hard it is, and I know this because I've dealt with my mother with this stuff for like the last couple of years. Like to even get the doctor to call you back is crazy. It's like sometimes it has taken me weeks to even get her set up to get blood work, someone to come and do blood work, or to get the doctor to, refill a prescription or just answer a simple question. So I mean, I love what you're doing. I think it is so needed. I really think it is the wave of the future. And we're going to get into a lot more. We're going to take a quick break. I'm talking with Dr. Tracy Cormier. Stay tuned. We'll be right back. We're back on the Dr. Diane Show with me, Dr. Diane Hayden. I am talking today with Dr. Tracy Cormier. You can find more about her at her website, which is www.tlchealthcaresolution.com. And Tracy is a Doctor of Nurse Practitioner, APRN, ANP, BC, and she's the owner and clinical director of TLC Healthcare Solutions. And basically, she has started a direct primary care service for patients. And I'll say, like, for people who have gotten fed up of the regular traditional primary care model, we definitely want to look into what Tracy is doing. She's doing some amazing stuff. So we've been talking mostly about just what is direct primary care and how you got that started and what it's like, to to come see you as a patient. I wanted to move into typically, who do you see? What kinds of things do you treat? So let's talk about like, what are you seeing most often, or what types of chronic issues do you treat, and
Mhm.
maybe what you're most passionate about.
So I treat just about anything a primary care would treat. I specialize in, again, preventative medicine, cardiology, sleep, hypertension, high cholesterol, weight management. I also focus on anemias, thyroid issues, kidney problems, like you name it. I've been in a critical care environment for like 20 plus years, dealing with very sick clientele. And I do specialize in complex patients, but I like to have a variety. I love having the younger folks come in and talk about their health and everything. So my age range really does fluctuate. I'm doing like 20 years old up to, I think my oldest is 84 years old right now. So again, big variety there, and multiple disease processes that I help these clients manage.
I love it. One of the things that you do is you treat sleep apnea, and you actually do home-based sleep evaluations. And I wanted to talk of that because I'm reading this great book called The Circadian Code, all about circadian rhythm and how we've gotten so far away from that with all of just the screens that we're on, and being not being outside, kind of being inside all the time. And he kind of breaks the book down into three things basically to get your circadian rhythm back on track, which is food, exercise, and sleep, of course. And so I think we're now learning how important sleep really is. I mean, I know people who would brag about how little sleep they need. And I'm not that person. I'm like, I need 8 hours, or you don't want to talk to me.
Me too.
Seriously, yeah. But not only that, it's like going to bed and waking up at the same time, trying to stay on that schedule every day, even on the weekends as well, which is really hard for people because social lives kind of get in the middle of that. But just the fact of how important sleep is, because that's when the body repairs everything. And so when we have issues as um, not as serious as just shifting a little bit in terms of when we fall asleep or not, to someone who has something like sleep apnea. That's like a critical part of our health that really hasn't been talked about that much.
Yeah, I agree. I've been seeing sleep apnea for many years in my practice, and they're just to even get in with like a sleep doctor, it's 6 months to a year. And then to get the equipment on top of that, it's been a very slow process. In the past few years, you've been seeing a lot of development of other ways to address this. A lot of people don't realize that sleep apnea causes uncontrolled hypertension, it causes structural heart changes. That's just two of the things that it can cause. It also puts you at higher risk for stroke. But the funny thing is I'll be seeing a client and they're with their loved one and I'm like, well, do you snore? And they're like, yeah, you snore. I don't know what you think. I mean, you're like a train, for crying out
Right.
loud. So now they've made things. I actually am with a company that I've known for a long time that it's basically an in-home sleep evaluation. And it's a good baseline reading. And it's funny because a lot of our watches, the rings that we have on, are now collecting data, and people are seeing, oh, wow, like something's not right when I'm sleeping.
Mhm.
And then they'll come see me, we'll do this study. And I'm very fortunate that I have a sleep doctor who will interpret it for me and determine whether or not a device is needed. So that really takes out a lot of the barriers, for the process that's currently being used. And then we work on all the other things that cause sleep apnea, right? The anxiety, restless leg syndrome, just to name a few. So we work on some of the other things in trying to turn off the TV, turn off your phone. I think we have an addiction to devices. That's part of the problem.
100%. Yeah, yeah, for sure. It's hard because we now access everything on them, right? Like, it's we do pretty you pretty much almost do your job exclusively on your phone almost in some cases. And it's like we're on it for that, we're on it for email, we're on it to talk to people, to text, like social life as well. So now pretty soon it's like social media. You could spend all day on it.
Right, exactly. And that is, you're on it constantly. I actually make myself take breaks from it because
Yeah.
get outside, look at something different. I have my blue light tinted glasses here to protect my eyes. Yeah, I mean, I think that that's a component that, I address in regards to people who are having issues sleeping, to try to like take note of it. I don't think people take note of it. And sometimes I'm like, well, let's look at your phone because there are timers on some of these things to tell me how long are you on Facebook for? How long are you on this site for? And people are like, I didn't know that existed.
Right. And they probably aren't even aware how much time they are spending on it sometimes, you
Exactly.
know?
Yeah,
Yeah, you can get lost in social media, that's for sure, and go down that
we
rabbit
sure
hole.
can.
Yeah. I don't want to get into like a whole lot of clinical thing, but I'm wondering if people are curious about what the relationship is between sleep apnea and high blood pressure or heart disease. Like, how does that happen?
So, sleep apnea is you basically stop breathing at night. You are not getting any oxygen into the body. And when you have no oxygen coming in and you're not breathing, that stresses out the heart. So it causes the heart to thicken. It can possibly cause like heart arrhythmias. And that creates the vascular tone to get stiff, which can then also cause the hypertension. So it's really important. I've seen people in the past go on the sleep device machines and their hypertension resolves. The key is to addressing it sooner than later. And there is this fear of, oh my God, I have sleep apnea. I'm going to have to wear this thing and look like an elephant at night. Sometimes people don't even need that device. Sometimes most people just need like a mouth guard nowadays. And I think it's just a taboo subject because they're like, well, I don't want to look like that when I'm in bed. So it's, again, more of an education thing.
Or even now, I've never tried one on, so I really don't know. I'm going to make this statement, but I don't know. It looks so uncomfortable. It may not even be the fact that you think you look funny with it on, but it looks like it's something uncomfortable to wear to try to sleep all night with.
Right. And a lot of my clients I said, listen, you've never had this on before. Even if you wear it for 2 minutes every night, eventually what's going to happen is you're going to fall asleep with this and you're going to have the best night that you've ever had of sleep. So it's just an exposure thing, right? Anything that's new, we have to keep introducing it because it's kind of a brain thing that blocks it. Actually, the devices now are a lot more comfortable than they used to be, and the new technology that's coming out is really impressive as to convenience and ease of wear.
Wow, that's awesome. Well, so when you go to someone's home for a home-based sleep evaluation, what are you doing when you do that?
So normally the company that I work with, they will send them all the equipment. It's pretty simple, actually. Like people think of, oh my gosh, I'm going to go to a sleep lab and I have all these things put on my head. I'm going to
Right.
look. And people don't want to do that because none of them sleep. So this is, again, because technology is evolving, this is actually really easy. It's like a heart monitor. There's something that goes on your finger. It's very easy to wear. Usually my clients, I'll do like a 2 night because usually the first night they're so nervous if they've even have it on correctly. But it works. It's great. I have good information that comes from it. And there are people that still, I need to get them worked up and get them to a sleep specialist. Some people do need that official in-hospital study. So it is a process. But the convenience and the wear and to be in your own home with this is key.
Yeah, that's pretty amazing because uh, again, and making an assumption, but yeah, when you hear about these sleep studies that you have to do, where you have to go to this strange laboratory and, Lord knows what they're going to be putting on you and whatever, it's like, it's almost comical to think that people would actually be able to sleep in those conditions.
Right.
And get an accurate reading. Like, shouldn't it be in your house when it's normal and that, like in your bed and all the normal things that you have when you're trying to go to sleep to really get a truly accurate reading? Yes.
Yeah, and that's what people like about it. The convenience of it. I actually one of the local towns, I just went and spoke with all the town workers about it, and they were like, "Geez, we were kind of afraid to get this done, but this sounds really easy." And I'm like, "Yes, that's what it is. It's easy, and it gets the information."
That
Who
should be your
used
new motto. Dr. Tracy, making healthcare easy. I love it. You're listening to the Dr. Diane Show with me, Dr. Diane Hayden. We're going to take a quick break. When we come back, we'll be talking more with Dr. Tracy Cormier. Stay tuned. We'll be right back. We're back on the Dr. Diane Show with me, Dr. Diane Hayden. You can learn more about me at my website, which is www.drdianehayden.com. And I'm talking today with Dr. Tracy Cormier. You can learn more about her at her website, which is www.tlchealthcaresolution.com. That's spelled TLCHEALTHCARESOLUTION.com. So I just love everything that we've been talking about today. I mean, like I said, your new tagline should be like making healthcare easy, easy and direct. That is you for sure.
yes.
What is one thing you wish every adult understood about their health right now?
I wish they would be out of denial, to be honest with you. I think a lot of people are in denial that they're okay just because they haven't been to see a provider. And that's one of my biggest things. Yeah, I have a lot of clients that I see in the hospital, and they're like, I've been healthy for 20 years. I didn't need to see a doctor. And I'm like, yeah, you did.
Mm.
One thing that I've been seeing undertreated is high cholesterol, and still to this day, it's just not treated effectively enough. So that's like one big thing I like to focus on with a lot of clients. They're like, well, my primary care said it was fine. I'm like, yeah, but it hasn't been fine. So I think just getting that message out there, and maybe there is a little bit of a fear to see the primary care and really know what's going on with your health. But I want people to be more proactive. That way we can keep you healthy and keep you out of the hospital.
And that's the whole thing, right? Like I can understand people having that fear, like, not knowing for some people is better than knowing. But at the end, it's if you are in a position where you can do something preventatively. I mean, there may not be any issues right now, but why not get that base, like look at everything, right? Whether it's blood work or whatever it might be, like the testing that you might do. Just at least have a baseline of something, and everything might be fine. And then you know where you're going from there, and you can give them a roadmap to keep doing all the preventative stuff that they're doing to stay healthy.
Exactly. A lot of clients I see with some of the labs that I do are a little bit more extensive, that give a lot more information. And I think that, you know, the traditional health model just really does the basic labs for people when they complain, when there's all these other evaluation tools out there that we're just not utilizing.
Yeah, for sure, for sure. I mean, definitely. If you talk to a functional medicine practitioner or even a naturopath, they run way more extensive labs than, your traditional medical doctor is going to even know to run.
Right.
And even looking at things like you mentioned, like cholesterol, like even looking at all the different, even knowing which tests to run. It's not just about the cholesterol number. Um,
Exactly.
so if someone's feeling frustrated with the healthcare system, what's the first step that you would encourage them to take?
Well, I want them to find a provider who will listen to them. And that's really what my mantra is right now. And I've always been this way. I love taking care of clients. I've done everything, from the bottom up. And this is where my home is, just listening to people and helping them understand, and just taking that time with them. I want them to ask questions. I want them to advocate for themselves. I feel that there's still that fear, there's that maybe intimidation feeling sometimes when you're talking to a healthcare provider. And I want them to feel that they're supported and they're not stressed about the interaction.
Yeah, I agree. I think also, there's a lot of people that just don't want to go on a medication, right? Or
Mhm.
maybe they're on a medication, they want to come off it. But their regular providers are either, not they don't want to go down that path of having the open discussion with the patient. right? They'd rather just be like, I'm the doctor, here's the medication, stay on it. You got to be on it for your life or whatever it is. And maybe it's even a factor of they don't know if they could get the patient off the medication. So I feel like that's where that has come from, that people just have gotten frustrated or even fearful about even being able to have an open discussion with their provider about something like that.
Right. I think a lot of it is they fear that, the doctors are working for the pharmaceutical companies. To be honest with you, it's frustrating. I guess I've been sort of performing functional medicine most of my career because I've always looked at other avenues for treatment for patients. And, we try it and it doesn't work, then hey, this is where we're at. But, we walk the path together to get the best results for you.
Exactly. Exactly. So for a listener, when you say taking control of your health, what does that mean to you?
Yeah, it means at least going to get evaluated and not waiting 20 years.
Right.
Because I was healthy when I got out of high school and now I'm 40 something and I've been healthy for that many years. So it's not just that, preventative care is out there for a reason to do the basic tests. But again, then there's, they don't have the relationship with the provider to have these more in-depth conversations and the questions to be answered. And right now I'm seeing a lot of people resort to AI and Google, and those are not the greatest answers either. So, again, I think this developing a relationship with someone, a provider who can help guide you through the process and at least get basic evaluation. I guess that's what I really want people to see and me for is like, let's look at everything, let's analyze it. And some people don't want to analyze it, but not to say we have to go on medications, but I can guide you down a different path towards healthy decisions.
Yeah, especially before it's too late, right? Like, like there's things that may be going on in your body that you don't even know about, like high blood pressure. Pretty much there's no symptoms, right? Or
Mhm.
even if you're borderline pre-diabetic, there may be no symptoms and you may have no idea if these things are going on until it gets to a point where you're in a situation where now you have to be on a medication because you can't treat it with just diet and exercise and more natural things because it has progressed too far.
Yeah, I see that all the time. I see that with patients that come in, the damage has been done. I see it a lot with AFib. That's another silent one. Most people don't know that they have these irregular heartbeats, and I see them with their first stroke or they have other vascular problems. So, if anything, it's just I would love people to make that decision to be like, okay, I am going to go see this person, and this person really cares about me, and we're going to review. And we're going to make sure that I stay on a healthy path. And, sometimes I give my patients assignments,
Good.
to stay healthy. So, when we touch base again, I'm like, so where have you been? What have you done? What are some of your readings? And I do because that it gives them they need some accountability, right? And I feel that does help, to help them move along that path of being healthy.
Yeah, I mean, it's, with anything, any type of lifestyle change that you're trying to make, it's hard doing it alone, right? Like, it's always better if you have a coach or a partner or a doctor like yourself that kind of walks that path with you because you do need to be held accountable. Even the, most disciplined people like myself, if I have somebody holding me accountable, I am definitely doing what I need to do, and I'll reach my goal faster.
Right. Yeah, I
Yeah.
agree.
I mean, it's really been one of my big missions, I guess, to really educate people on taking responsibility for their healthcare. And to me, that means if you have to pay out of pocket to see a practitioner, then that's what you do. And it's funny is not the word, but I'm going to use that word. How people just don't want to pay for healthcare. It's like, you'll
Mhm.
go out and spend money on alcohol or, restaurants or entertainment or the new car or whatever. But what good is any of that stuff? Travel, and don't get me wrong, like I'm all for spending money on travel and that kind of thing. But if you don't have your health, in the long run, what good is any of that stuff?
Yeah,
You're not going to be
that's
able to
true.
enjoy it.
Right. Some of the questions I have is people do use their insurance for labs and like diagnostic imaging, just so you know. And there actually was a bill just passed that people can use their HSA accounts for direct primary care membership starting January 1st. So that was a really big shift. Otherwise, the membership itself was an out of pocket. But some visits for like some of my clients, I give them bills and then they submit it towards their insurances. So for them, it just makes, it's less complicating, I guess, and not as stressful for them.
Right. Right. And that's great that there you can use it for some things, but when it comes down to it, if you have an issue that traditional medicine is not solving for you, then you need to pay out of pocket for that if you want to get better. I mean, it makes me crazy how many people go to so many different specialists to just use insurance for years and not get the problem solved when literally they could have just, gone to a functional medicine provider, someone like yourself, and had gotten it solved in way less time.
Yeah, I definitely agree with you there. I just don't think that people are aware. But I will say I am seeing a big movement to, especially people between like 35 and 60, like they're like, we're done with this healthcare system. We want something better. So things are
Yeah,
evolving.
good. Things are changing. So, just one last takeaway that you'd like our listeners to know.
So I guess healthcare doesn't have to be complicated or exhausting or stressful. It can be simple. There are supportive providers out there, and I want you to be empowered to take care of your health. So I guess that's kind of my little mantra.
I absolutely love it. Yep.
And making healthcare easy, as
Yes,
you
I'm
said.
telling you, that needs to be your tagline. Because to me, easy is no stress and, not a lot of anxiety over it, and basically just going to see somebody, like you, and getting it done and having somebody that is going to treat you like family. That was another really important thing I think that you said, that like you really get to know the patient and their family and you treat them like family. And I would love it if this took off and it was like a way to bring, the old time doctor of the past back. I think that would be
Yes,
amazing.
I'm trying.
You certainly are, and I'm helping you. So
Thank
thank you
you.
so much, Dr. Tracy. This has been a pleasure. It's been great getting to know you and learning everything about you do. And thank you so much for being on the show.
Thank you. I'm honored to be here. So thank you so much.
Oh, you're so welcome. And I want to thank all of you listeners for tuning in. Please join me the first and third Thursdays at 11 a.m. Eastern, 8 a.m. Pacific, and I will see you back here next time. Thank you for tuning into the Dr. Diane Show, revolutionary expansion of mind, body, and soul with me, Dr. Diane Hayden. Tune in every Thursday at 8 a.m. Pacific, 11 a.m. Eastern on transformationtalkradio.com. Center your thoughts on what you want and shut the door on every suggestion of fear, worry, or lack from your own consciousness or the consciousness around you. Once you master that, everything is possible. To learn more about me, Dr. Diane, and receive a free digital subscription of my magazine, visit naturalnutmeg.com.